cause heart disease or cancer. But specifically when we look at heart disease, this is all based around the flawed hypothesis that eating more fat, and specifically eating more saturated fat, leads to heart disease through the intermediary of raising your blood cholesterol. And really, both parts of that hypothesis are false. And just, again, I am a heart surgeon. I deal with heart disease every day, and I have no reservations recommending for my patients and doing it for myself, carnivore diets. And it's really a myth that eating more red meat is going to be bad for your heart.
You want to be viewing your health as a system, not as a goal. And what that means is that you don't want to be necessarily focused on just the short-term goals. Many people say, I want to lose 20 pounds. And when you focus on short-term goals, one of two things tends to happen. Either you meet that goal, you're able to lose the 20 pounds by doing whatever you do, and then you say, great, I did what I wanted to do, and you tend to slide back to your old habits. Or probably more commonly, you don't meet that goal. It's hard to lose 20 pounds and, you're doing this restrictive thing. And so you just give up and you sort of lose hope. And in the end, neither one gets you to a good spot. So instead, what I try and get people to do is focus on their overall health, focus on the system. I want to be metabolically healthy, and I am going to find the habits that promote my metabolic health. It's a more positive way to think. It's a more sustainable way to think. And I find that it leads people to more success.
I want to point out how important it is to be doing coronary artery calcium scans serially, getting scanned annually or every other year. One scan certainly gives us an idea about where you stand on the heart disease front, how significant or hopefully insignificant, heart disease may be in your context. Progression over time is another very important factor when it comes to coronary artery calcium scanning. I think we should be more aggressive with coronary artery calcium scans than most practitioners are. Seeing progression of scores or lack of progression of scores is a very important predictor regarding heart disease risk as well.
What I always point out to people is that the one number on the cholesterol panel that most doctors focus on, the LDL cholesterol, so-called bad cholesterol, is not a measure of metabolic health.
When someone comes to me and they're like, my doctor is really, pushing me on the LDL front, the answer is get a CAC scan at least, because that can give us some more information about what we're actually interested in, which is whether or not you're developing coronary plaque. You don't feel your LDL cholesterol level. LDL doesn't actually kill you. Heart attack is what kills you. And that's the concern. So let's see if you're forming plaque in your arteries or not. And this is really my contention with LDL as a metric of health in general, is that it's a lousy metric of health. It's a lousy predictor of health. And let's really get the information that we care about. And the information that I care about, like I said earlier, is the quality of your cholesterol, not the amount of your cholesterol, and whether or not you're forming plaque in your arteries or not. To be perfectly honest, many people may go to their family doctors and start asking questions, and not that your doctor isn't going to be cooperative. Your doctor maybe just doesn't understand this, doesn't know this detail, and that's when it might be worthwhile in finding another practitioner to work with, someone who does understand these nuances and can help you to, get through all this information.
Words of advice is you got to figure out your why. You got to, have that conversation with yourself as to why am I doing this? What am I trying to accomplish with whatever changes you are making? And ultimately, if you come to that true why, you're going to realize, that the why is more important than the food that you think you're missing. You also have to realize that processed food is addictive. Sugar is addictive. And with as with any other addictive substance, there is a withdrawal period. And, you sort of just have to power through that, like detoxing from any drug. There's a little bit of grit, I guess, involved in it. And that's where the why comes in. Because if you have that why, if you know why you were doing it, that's what's going to allow you to get through that difficult period.
You have to be doing this for yourself. Don't worry what other people think about it. Don't worry what other people are saying, your family, your friends. This is something that you need to do for yourself, and you need to be willing to take the risk. And I'm going to put risk in quotations. We think it's a risk, but it's really all benefit. But just go ahead and do it. You owe it to yourself.
First one is your waist circumference, more predictive of health than your weight. Best to measure it first thing in the morning. And if you are a woman, you want that to be less than 35 inches. If you were a man, you want it to be less than 40 inches. The next measurement is your blood pressure. You want your blood pressure to be less than 130/85 without the use of medications. Your fasting blood glucose level, so the amount of sugar that's in your blood when you haven't eaten for about 8 to 12 hours, and you want that number to be less than 100 milligrams per deciliter is the units here in the United States. Your HDL cholesterol, the good cholesterol is its nickname. And as the nickname implies, you actually want more of this, which is always confusing to people. Specifically, if you are female, you want it to be over 50 milligrams per deciliter is the units. And if you are male, you want it to be over 40. Finally, we look at the triglycerides, another fatty acid that's measured protein-bound fatty acid that's measured on the blood test, and you want that to be less than 150 milligrams per deciliter. Again, on that, less is good. So you look at those 5 measures. If 3 or more of those are abnormal, you are officially diagnosed with what we call the metabolic syndrome. It's a medical diagnosis, and it means that you are at very high risk of developing things like diabetes, heart disease, many forms of cancer, Alzheimer's disease. All of these things have been associated with the metabolic syndrome. If you have 1 or 2 abnormal, it's a warning sign, because we know that people that have 1 or 2 abnormal today are likely to progress to the metabolic syndrome over the next 5 to 10 years. And if all 5 of those measures are within the healthy range that I outlined, congratulations, you are one of only 12% of adults in the United States that can meet all 5 measures of metabolic health. Virta Health just released their 5-year data now. Previously, they had their 2-year data out there showing, 60% reversal of type 2 diabetes. At 5 years, the numbers are still above 50% reversal of type 2 diabetes. And what's unfortunate is that wasn't the front page New York Times, headline that it should be. To be able to reverse a disease is always better than just trying to manage the disease.